A mental disorder is an illness of the mind that negatively affects an individual's thoughts, feelings, and behaviors. Recent research findings have helped clear up many misunderstandings about mental disorders. In the past, people with mental disorders were often feared or disliked. Now we understand that mental disorders are the result of chemical imbalances of the brain. There are two types of mental disorders: organic and functional. Organic disorders are mental disorders that are caused by a physical illness or an injury that affects the brain's ability to function. Examples of organic disorders include brain tumors, strokes, infections that affect the brain, and some inherited chemical imbalances. Functional disorders are mental disorders that are caused by psychological problems, such as disorders resulting from stress, emotional conflict, fear, or poor coping skills. Examples of functional disorders include anxiety disorders, depression, and personality disorders. These disorders may result because of past traumatic events, current causes, or chemical imbalances. Depression is a mental disorder that is classified as feelings of sadness, hopelessness, and despair that last more than a few weeks. Depression affects an individual's ability to function properly. Symptoms of depression include a sad or irritable mood, a loss of interest in activities that were once enjoyable, large changes in appetite or weight, difficulty sleeping or oversleeping, slow or agitated movement, a loss of energy, feelings of worthlessness or guilt, difficulty concentrating, and frequent thoughts of death or suicide. Depression is a serious problem. If you suspect that you or someone you know is suffering from depression, seek help. Contact a trusted adult, such as a parent, teacher, or school counselor. Depression is treatable. Treatment could make the difference between life and death. Depression is a major risk factor for suicide. Suicide is the taking of one's own life. Other risk factors for suicide include substance abuse, violence, emotional, physical, or sexual abuse, or prior suicide attempts or exposure to other suicides. We can recognize the warning signs of suicide in ourselves and others. The following are some of those warning signs. Verbal statements like, "I want to die," "I just want to go to sleep and never wake up," or "I won't have to put up with this much longer." Lack of energy and zest for life. Increased risk-taking, like driving recklessly or acting violent. Withdrawal from family, friends, and social activities. You can aid others who are suicidal by helping them seek professional help as soon as possible. You can also help them to see that you do care about them. The following are tips to help you show a suicidal person that you care about them. Take any and all talk of suicide seriously. Actively listen, show your support and love, and do not judge them. Stress the temporary nature of his or her problems, and that professional help can make things better. Do not leave a suicidal person alone if you suspect that there is immediate danger. Do not agree to keep a secret.